So good morning. So I'm here to extract an ABG. First and foremost, we check the patient's chart, obtain any important information, and then once we're done taking those information, once we go inside, make sure we sanitize or wash our hands, introduce ourselves to the patient, and then we tell the patient what's the purpose of this, such as telling them that this test is different from other extraction because we're gonna extract it directly to your artery. It's a little bit painful, but I just try to relax your arm. So this also would check your oxygen levels in your blood and also to assess if how are you doing well with your therapy and with the oxygen in place with you. So after that, make sure we check the patient's ID band for confirmatory purposes. And then another thing is we always do our set of vital signs, our pre-assessment with the patient. So once everything is done, we move on in doing with the ABG thing. So first is we always have to wear PPE such as gloves, which is important in extracting ABG. And then after that, we always have to check, especially if which one is the patient's dominant arm. So if the patient's dominant arm is in the left, so we always do it on the right. So before proceeding with the ABG, we let the patient do a modified challenge test by opening and closing their fist for about 3 times while we occlude both the radial and ulnar artery. So after that, we remove the ulnar and we will notice the color on their palms. So that means that they already have a proper blood flow. So another thing, if we notice this to be a negative modified challenge test, we always do it on the other arm just to ensure that we got a positive modified challenge test. So with this is we always make sure we put something underneath such as a tissue or a towel in place just to allow the patient's arm to hyperextend, and then make sure the supplies are complete in here. And then after is we always clean it with an alcohol prep pad in a circular motion, and then with a needle we always make sure that we have to position the bevel like this and hold it like a pencil or a pen. And because we obtain blood in the radial side, we always position it in a 45-degree angle. So first is carefully palpate the pulse. After we sense the pulse already or we feel it, carefully insert the needle to the site. And then once we insert it, we notice some blood filling in the tube. If it's already filled up, carefully remove it and then apply pressure with a clean gauze. And then with this needle, make sure we have to puncture it directly with this stopper and then dispose it together with the stopper in a sharps container. So assuming we dispose it already, we always have to make sure that we apply pressure for about 3 minutes or 3 to 5 minutes. And if the patient is taking up any anticoagulants or blood thinners, make sure we apply pressure for more than 10 minutes. So with this one, we always have in case to have another clean gauze just to remove any tiny bits of clots or air bubbles present. And then we have this safety cap. Sure, we mix it up for a few seconds and then put it on the safety in the biohazard bag. And then with this biohazard bag, we always have this label, which is important, where we're gonna put it in here. Make sure we have the ventilation. With the ventilation, regardless if the patient is on any device such as nasal cannula or any oxygen device, the important with this one is we never put the flow, but we compute it directly because we always make sure we put it the oxygen percentage. So with this, we immediately send it as soon as possible. But if you could not do it so, make sure we have an ice in place to prevent the specimen to be clotting. And then after applying pressure, we always have a band-aid. Put it there for about 4 hours to prevent any infection. Still, I'll let the patient apply pressure. So once everything's done, we always have to clean everything on the table and then remove anything from the patient, such as the towel, and then reposition the patient, let them be comfortable, obtain any vital signs, assess them, post-assessment, and then remove the PPE, make sure we wash our hands. So if everything's done, once outside, we already send this one immediately. Make sure we coordinate or communicate with the nurse in charge what our assessment with the patient observation is, and make sure we always chart it in the patient's chart.